Good morning, everybody. I'm Andrea King. I'm the Director of the Clinical Division at the Anna Freud Centre, and it is our privilege to host the National Centre for Family Hubs. It's such a privilege to welcome you to the second annual conference for the National Centre for Family Hubs, and you are most welcome here. As the past year has unfolded, and together we've adapted and adjusted to the challenges that face our society, our economy, and our communities, the really important opportunities that family hubs offer, local babies, children and families, remain central in our thinking. A high quality whole system thinking from conception through teenage years to adulthood, a thinking that engages the whole family and all of our partners is crucial. Co-production with local people who need this support with the communities that surround them is essential. Today, we turn our attention to making sure that family hubs are accessible and inclusive of all. And as we do that, we recognise that inequalities are embedded in our society and our places of work. The cost of living crisis is deepening. The number of children and young people experiencing poverty in their childhood grows. Right now, 3.9 million children are living in poverty in the UK, and that number grows every day. It is imperative that family hubs are a place of genuine welcome for all, and that we find ways in partnership with voluntary community and faith sector leaders to reach out differently to those who've had a poor experience of asking for help in the past. I hope in the lineup today, you see the range of insight and experience and expertise that our colleagues contributing to the programme have agreed to share. And I want to thank each participant for their time to help us shape individual, community and societal change. Our programme builds on plentiful good practice from around the country, and it has been influenced by children, young people and parents and carers who helped us shape the focus of today. I want to say a special thank you to them. The Anna Freud Centre has worked in really close partnership with colleagues at the Early Intervention Foundation to develop and to test with local authority colleagues best practice about family hub implementation. Together, we've disseminated that learning through the large number of resources in the National Centre for Family Hubs Toolkit and all of the associated webinars. In these resources, we continue to navigate the range of policy objectives which are led by our colleagues at the Department for Education in close partnership with the Department for Health and Social Care. We've integrated that in a new pan-governmental dialogue which we have the privilege to host and chair. And with the evolution of integrated care systems and the long-term or 10-year plan. Please take the time to have a look at these resources. The evidence tells us that children and families most benefit from a universal offer, with dedicated outreach to our members of the community who experience marginalisation and exclusion. That access to family support early in life or in pregnancy, and those very first 1001 days really does make a difference later in life. The breaking down of barriers between agencies and sectors, between staff and volunteers, and the focusing on building relationships of trust can make all the difference. So today, we look forward to learning from established good practice and the new innovation that helps us to co-design family hubs in a way that genuinely welcomes and is accessible to all. We've published an initial draft access and inclusion module, which should be in the chat now. Following today, the National Centre will publish a second edition of the module containing the case studies of practical approaches, hearing from many of the contributors to the conference today. Please do participate. Please use the Q&A function to let us know your thoughts. I'll be handing over to Julia Mays, the National Centre Evidence and Implementation Lead next, but first, we've spent time listening carefully to the experience of our children and families and our frontline workers too. And we want to start with a video that captures just some of these conversations.
My name is Sharon Blake and I'm a family navigator at the Family Hub here in Westminster. So part of my role here as a family navigator is organising TAFs, and that's team around the family. And that can be anyone from school, mum, auntie, it could even be a neighbour. Anyone that supports that family and wants to help is part of the TAF. One of the really important things to do is to be able to give confidence to other professionals. Sometimes they're like, we need someone from social services or early help, but they really don't. And it's about giving them that support to say, you can actually take control of this meeting. You can do this, and I'm here to support you. That takes a lot of pressure off. And giving other professionals the power to do that and supporting them in doing that is really important, because there's a lot of young people out there that won't hit the remit for social workers or for early help workers, but there's so much support that we can do. And working here at the Hub, I've really discovered that you know, people that wouldn't be referred in are getting support. So it's a really positive thing.
My name's Phil Bannon. I'm the Chief Executive of Young Westminster Foundation. Young Westminster Foundation is a local partnership of youth organisations, businesses, the local authority and wider partners in the community, all with an interest in supporting the needs of young people in Westminster. At the moment in Westminster, the family hubs and the youth hubs are different physical buildings, but we're looking at providing more projects and activities within the family hubs to get young people and teenagers attending the physical buildings, the family hubs, and that's our vision for the future really, in terms of integrating youth services into family hubs. So currently Youth Voice is central to the work of Young Westminster Foundation and the youth hubs in the borough. The way that we do this is work with young people as peer researchers and young ambassadors and undertake regular consultation to inform our work. This includes our young ambassadors undertaking peer research through our regular needs analyses, which then feeds into the need and the priorities for our fundraising and the projects and activities and programmes that we put on within Westminster, within the family hubs and the youth hubs.
My name's Pauline and I have a dual role at the Family Hub. So one part of my role is I'm a senior practitioner for family support, and the other part is a group coordinator, and that is for a particular service for children and women that have experienced domestic abuse. So children that have witnessed or been exposed to domestic abuse, and for women and mothers that have experienced domestic abuse. So we would think about how a child's exposure to domestic abuse may be having an impact on their lives. So in terms of their education, in terms of their social interactions, and really just giving them the space to be able to talk freely about it. Domestic abuse can be seen as a secret. So sometimes children have lived a life where they continue that secret in a way. And this way, in terms of the group, they're able to talk more about kind of how it's impacted on them and how they feel about things that may have happened in their homes or out in the community. So really it's giving them the space and opportunity really, which is crucial. Yeah.
So we do lots of different types of local outreach. A couple of examples I'll give you is getting the faith leaders involved with our families. So, for example, I went down to Regent Street Mosque and I promoted the Family Hub, making connections with the local community, letting them know what we do here, inviting them to come down and have a look around. Sometimes it's just getting out there and explaining to people what we've got, who we are. And I see sometimes people walking past and I think, I know they're looking to say, what's that in there, 0 to 19? So it's really good to do that. And then word gets out within the community, and it's really nice for people to say, have you been to the Family Hub? Do you know they can help you? They can do this, or they will show you where to go. And I think now with early help and the remits are so high that this is a really important service.
My name's Sarah Momtaz, and I'm one of the parents here for one of the kids that attends the nursery. My daughter's name is Amani. We came here, our first initial contact with the Portman was by coming here and using the drop-in services. And that's how it all really developed, and I signed her up for nursery, and honestly it was probably the best decision that I've made since she's been born, quite honestly, yeah. Amani is what is referred to in medical terms as having complex needs. And our specialist health visitor had recommended this particular nursery because they specialise in looking after children with special needs, although they are a mainstream nursery. I didn't want her to be categorised and isolated in a special needs unit throughout her life. You know, it's all about integration, being in an inclusive environment, being valued as a child, which I believe is the right of all children, irrespective of their abilities. And I contacted the Portman last year's summer, not knowing that, of course, they'd be closed because of COVID and it was the summer period. And the caretaker actually answered the phone. And I asked him, is that the centre that looks after special needs children? And he actually went into all the things that they do. And I thought he worked there. I thought he was maybe a receptionist. And he told me, oh no, we're closed. We don't open till the 1st of September. I'm the caretaker. I look after the building. His knowledge and engagement and the fact that he knew so much really drew me in. The whole essence of family starts with the staff. And I got that impression when I brought her in. He told me that the drop-in centre was open so that she could come in, basically have a look around. Drop-in centre being that you stay with the children while they play. And I got introduced to some of the staff there and a lovely lady called Sue, she took to Amani. She told me so many things about the centre. She's been here a very, very long time and all the things that they can do and how I can sign her up for attending nursery. So I went through the process that way, and then I got to find out about all the amazing things that they do through the Family Hub, so all the other services that they have.
We're here to support everybody in Westminster. We're a really inclusive family hub. And it doesn't matter if you're a mum or a dad or a grandparent or an auntie. If you need support, you know that you can come here. You can come to the Family Hub and you can ask any question. No matter how silly it seems, there will be someone to point you in the right direction or to support you there and then.
I think the Family Hub is, I guess, crucial to the community. I think one of the things that is really important in part of all our roles here is, I would say, critically building relationships at those very early stages with families. So we take pride in the fact that, we take time with families, they get to know us and trust us. We can identify and assess need and think about services that they may benefit from. So I guess navigating those services to meet the needs of the families as opposed to the other way around. Being in the heart of this particular area, we're there. So in terms of, people just coming in, I think it's nice to know that people could, kind of be just passing by and come in and be curious about the service. Sometimes a family may come in for one thing in mind, but actually then we're able to say, but also we have this service as well, so this might be useful for you. So again, coming back to that, building up those relationships, but also helping families navigate what they might need.
Our young ambassadors come from a whole diverse background within the local community, representing different cultural groups, different localities within the borough. And this is really important for us to ensure that we've got the cultural competency and the voice of different communities feeding into the work of Young Westminster Foundation, the work of the youth hubs and the work of the family hubs.
The collaborative work that we do and the integrated part is the whole basis of the model and the approach that we have and part of our pedagogy here. So being able to have colleagues that are in the same building that you can speak to and talk about families or family needs or what they might want or how we can offer that is really beneficial, because you're not going or you're not calling them, they're actually in the building with you, and we're able to do that very quickly so that sometimes there are no delays in terms of how families may get a service, because you've got a colleague next door or sitting next to you in the same room where you can say, oh, actually, can we have 5 minutes to talk about this family?
So one of the other projects that I'm doing at the moment is working with 3 hotels in Paddington, and they house asylum seekers from all over the world. We got together a bit like what the team around the family is, but we call it the team around the hotel, and we invited lots of different agencies, and it was down to me to go out and make these contacts. So we have Care for Calais, Family Lives, Befriend a Family, even people that we can get bikes off, just lots of different people, just so that these families who are on £8 a week feel like they're human beings, feel like the community want to support them. And that's all part of the family hub work, because everybody who lives in this part of the North East, or, you know, in Westminster, they are part of the community, no matter where they're from, no matter how they got here. And it's down to us to make them feel like they are part of our community.
The family work in Westminster has really developed with the integration of youth hubs and family hubs. And what we've been seeing now is youth hubs having more of a family-focused approach, because they're able to access information and find out intelligence from colleagues in early help and the family hubs, which is great really, because it means that they're able to better support the needs of the wider family.
It's just such a delight, because with children, like I said, there are no inhibitions. There doesn't need to be, if you can't run around with me, I can still play with you. If you can't talk to me, I can still communicate with you. And that's something that you can see is the essence of what the team here instill in the children. And that's what they learn growing along, as they grow older and as they progress and want to go into school. And that's one of the things that really resonates with me and my family, because the inclusive environment here is exactly that. It's inclusive, but it's more than that. It's value. And that's one of the things that I was really concerned about for my daughter, because I thought that she won't be as valued as a typical developing child, because she's got a lot of complex needs. But I don't get that here. She's valued and she's loved.
I can see it reaching so many different people across the borough, and it's really something that I feel really proud to be a part of, and from the beginning as well. And yeah, it's very good. Yeah.